First milk, yeah, Belitas. Special charge and 2,000 regularly cancer patient, and I'm delivering one lecture for the homeopath one in the month.
Oh, well done.
And every lecture on 3 or 4 hours. Long lectures, different topics, cardiology, radiology, skins, every type of system diseases. And I'm with some
4 there. When everyone's here, switchboard there, accounts there, office manager there, web and social media here. I mean, it's, you know,
Complete
and we're
set.
still growing, so the space is getting a bit
Yeah.
tight, you know. And then production manager's office there, my office in there. So
okay, very good.
but it's good, yeah. But the other thing is one of our strengths is having lots of homeopaths. I mean, these two here work, and most of the ones in the dispensary are
They
actual homeopaths.
deal homeopath.
They're real homeopaths, yeah.
Both are.
And they often have their practice. That's why we have a lot of part time.
They receive the
So
calls,
they give very good
the
advice
advice over the phone.
for acute prescribing.
Oh, yes.
Yeah, yeah. Label room. We do a bit of. We have a couple of labelling machines.
Okay.
There was another one in the basement which I didn't show you.
Because
Because you know, labelling small bottles, hundreds and hundreds of them, you know.
this is the labeling machine.
Labeling
yeah.
machine.
Yeah,
Very good.
yeah. Yeah, there was one downstairs I was going to show you. But,
What is the capacity of this machine?
this is
How
quite
many
slow because
label daily?
it's a conveyor. It's for what we use for the bigger size bottles. So I don't know how many it does a minute, but it's somebody has to put it on manually. Whereas the one downstairs is a frame which does them, drops them one by one. So this is for bigger sizes, like those bottles there, for example. Those are going to be done on this. I don't know. I thought maybe we'll see James and he can tell us the rate. So in here is the main, you know, like the clean area. So we can just poke our heads around and have a quick look. But usually,
Stop one.
you know, you have to put all the gear on and
Yes,
everything. So this is like the airlock, as it were. I can show you. Hello, we just have a few heads poke round to say hello from Pakistan. So if you want to go and have a look, and you can see. That's fine. Just come.
Yeah,
Just don't go too far. Yeah, because
yeah, that's fine.
so we're making, box
Hello.
remedies and
Okay.
we're making kits here.
Oh, that's
Yeah,
nice.
so it's very well organised. And they're a fantastic team.
This kit, you can purchase this
Yeah,
kit.
I'll give you one before you leave.
Okay.
I'll give you one. So
For
then there's,
emergency kit, we use what this. This is very good for
Yes.
emergency medicine.
Indeed,
To pocket,
yes.
in car and when you travel. This is very
yeah, and single remedy.
yes, yes. I need this.
Yeah, I'll give you one. I'll give
Okay,
you one.
okay,
Yeah. And then we'll go up here.
This is very good. This is a.
Is that leather pouch?
Yeah, we got as well.
This is the main office.
Oh, yes.
Everyone's at lunch, are they? Hello. This is Dr.
Hello.
Ali and his family from Pakistan. Who's,
Hello,
one of our
okay, thank
good
you.
customers. So he's come to visit. So this is where all the
Okay.
information comes. So this is Callie, who looks after all the web and the
Okay.
social media. The office manager's there. These are the email. So we have a small laboratory where we do some tests.
Quality control.
Yeah, we could do some basic tests on the mother tinctures and on the lactose and sucrose, etc. So we've got quite a few chemicals in here, and then it's mainly regulatory affairs, paperwork and risk management and all those things that you need for good manufacturing practice. Like a pharmaceutical. So we are a very small pharmaceutical company, and so we have to abide by those kind of rules and regulations. So qualified persons at lunch at the moment. Friday's a quiet day for us, but so all this together with the pharmacy as well means that we can have the quality all the way, the GMP standard all the way to the pharmacy, and that helps us as well with being able to supply pharmacies in other countries. Apart from the fact that Brexit has now spoilt that, because pharmacies in Europe can only buy medicines from within the EU. So our European business is going down quite sharply at the moment. But the UK is rising steadily, and America and Canada and Switzerland are doing well. So,
And we can install like this pharmacy in Pakistan.
well, don't you have a pharmacy in Pakistan? Don't you have one?
Many, but I'm the only practitioner. Okay.
Yeah.
But I am, inshallah, I will connected with you.
Thank you.
Inshallah, I will purchase from
You have my details and all
Yeah.
my details. Yeah,
Yeah.
great. Yeah.
I will give you my personal number and I will talk to you.
Well, we're happy to support in any way. I don't know how it is for us to get things to Pakistan, to send things to Pakistan. Does it work?
Oh, we have that arranged. We've got that area covered.
Oh, have you?
Yeah,
Good,
we've
okay.
got that part of it covered.
Okay, great.
Yeah, because as soon as we get it from you, we've got
You know how to.
we've got means of methods of getting it.
Oh,
That's
excellent. Very
no
good.
problem.
Yeah. Yeah, that's what we're finding now with the Europeans who want large orders. They get their own courier to do it.
Because what initially the plan's going to be is to bulk buy.
Oh God. Okay. I'm saying that because we've got so much.
That is going to be moving forward. That's going to be the plan
Okay.
to basically bulk buy, but obviously with enough notice to yourself.
But by what? The medicated liquids,
Yes, whatever we need.
Yeah.
Okay.
Obviously, we can send you a list across and saying this is what we require.
Yeah.
Tell us when it's going to be ready.
Yeah. Okay.
That way, obviously, we've got the understanding there that you have enough time to do it. We've got enough time to get it done.
Yeah.
And just come to some kind of agreement that how much it's going to cost per unit for us if we buy this many units, how much if
Yeah,
we
of
buy
course.
that
Yeah.
many units.
Yeah.
So it works out.
But it's
best
a fairly
for-
we've got fairly standard pricing structure,
Yeah.
so particularly for the med parts, which
Best practitioner in Pakistan, 300, 400 patient daily. So nobody
How can you do
in
that?
the UK.
homeopaths in the UK, they have an hour, They
I
have
don't
8
see-
patients a day,
Eight,
maybe.
no, 300, 400 daily.
And they go to
And
when
my
they.
highest rate is a 450 patient daily.
It's impossible.
That's true.
No, you do that.
I'll just
on
take
your
1
own?
minute.
Just
I'll
on your
take
own?
one.
Just you.
Only mine.
Yeah, only
Hundreds-
I
hundreds
take
a
1
day.
minute.
yeah.
1 minute.
1 minute for one
How can you
patient.
do that?
I see the posture, structure,
Just
moving.
experience.
Oh
Yeah,
yes.
just-
Yes.
This is the snapshot practice.
Yes.
You just see the face and you prescribe the medicine.
Amazing. And is homeopathy as much in demand in Pakistan as it is here? More and more,
I've
yes, the same here.
seen 15 lakh patient, 15 lakh in my
It's going crazy with it.
Yeah, because people are wanting an alternative out there to get the jobs. Yeah.
I'm testing the
And people can't get to the GP,
No.
Yeah,
no.
exactly.
Do you
So
live
hard.
here, do you?
practice.
Yeah,
we
will
live-
go here,
30
yeah.
years.
Yeah,
30 years.
yeah.
My practice.
Nice to see Dad, eh?
Yeah.
Yeah.
Okay.
Okay, I'll show you downstairs. There's some more things down here.
ये बनती नहीं इसमें
बना दो साथ
ऐसा पाकिस्तान बुलाया ना जगह
So we've got more remedies down here, lots and lots of boxes. These are the strange, rare and peculiar remedies, but also the backup boxes, for... So we've got the aconitine upstairs, but then we've got the, all the intermediaries, again is exactly in the same in the same way.
Same way.
Same way, yeah. So there's again A to Z all around. You know, it's it just grows and grows because we're adding more remedies all the time. You know.
I'm happy to see your work.
And these are this is our machine. I don't know what stage it's at. Okay, this one is just ready to start a new one.
This is the potentizer.
This is the potentizer. Yeah, I can't show you running at the moment, but
this is the.
but the principle is that it's like an arm, and then this vial fill these three things to bring in the water and air, and so it shakes.
How much price of this potentizer?
So
How
again,
much price of this potentizer?
What's the cost of this?
What's the
we had
cost
to
of?
make it. We had to make it. You can't buy them. I'll show you one that you can buy, which is about £25,000. We've got one next door, but these we made ourselves.
We can buy this.
No,
No,
not
they
anymore.
make
The
it
guy who
by
made it
themselves. Yeah, they made
can't
it
do
by
it
No,
anymore.
no. Where you can buy this?
Well, I'll show you. I'll show you another one
Yeah,
in a minute.
you get-
Yeah. Anyway, the principle of this is that this vial leaves a bit in the bottom. It shakes,
Okay.
Yes,
empties, refill. The compressed air does it. So we have two on the go, and then this controls the potency. So here we've got it at just doing a 200, so 195, but sometimes it's got
No.
99,
My question is this:
995.
if one medicine prepare and you finish the job, and then other how can wash you the?
You don't
Next
wash
one.
it. It goes in the oven.
Okay.
It goes
Okay.
into heat. Goes to
Okay.
heat up.
And you change this tubes
And the tubes, everything. Yeah.
everything
goes in
on
there.
every medicine.
You see, you've got
Yeah.
the tubes in there. Yeah.
Okay, okay.
So there's a whole ritual that the tube gets changed. I mean, I think this one is the air, and then this one is the water. So this one's only going in one direction.
First you prepare in water, then you use
In water.
alcohol.
Exactly. Yeah.
That's
Let
good.
me show you the other machine. This is one that you can buy from Switzerland.
This is another one.
This is another machine.
This
yeah.
one you can buy. It's 25,000 pounds.
Yeah. It has. This works by. It has these blocks that go in there like that, and then the bottle screws into there, and it goes on like that, and then it fills, shakes,
Okay.
fills. But the lady who usually works is not here on a Friday, unfortunately. Otherwise,
Okay.
I could have shown you more. But you can have two going at the same time. It still works with purified water, which is the system we've got upstairs.
Okay.
But yeah, these are commercially available.
This
Okay.
is available.
They're
this
expensive.
will.
They're expensive, but if you want to know the name of the company, Pakistan, you're the president of an association.
Yes, yes, I am president of Pakistan Homeopathic Research Society.
Ah, fantastic.
Yes, and many number of patients, 300 or 400 daily.
Yeah, wow. Gosh.
Very busiest practitioner in Pakistan.
Yes.
India, so forth.
I know. We're always amazed
I
about how.
15,000 special trials we treated. 15,000 registered special trials.
Specialties, yeah.
Around about 2,000 cancer patients. Otherwise, a normal patient, 3 and 4, between 3 and 400 daily.
Most homeopaths in the
My
UK,
two sons,
they see maybe
my
6.
two daughters are specialist in pediatrics, and my 2 sons is a homeopathic doctor.
Yes.
They work with me.
Very good, wonderful.
I want to see many medicines, rare medicines, or muscles, or they are not available in Pakistan. That's why I order here.
Yes, well, no, so
My
it's
daughters booked here medicine.
yeah, no, so it's difficult for us. But I was lucky enough to get some good sources from Borwick and Taffel many years ago.
Borwick and Taffel.
Yes, before they closed. So I've got particularly some of the high potencies, which would be very difficult to get.
Borwick and Taffel is the old manufacturer.
That's right. Yeah.
I know about it. He's from America.
But redoing them is difficult. We have a couple of nosos that have been redone. We have a new Medorrhinum and a new Bacillinum.
Bacillinum, Bacillinum.
But see, but some of them, you know, are
But
still.
you prepare bacterial source, that's means chlamydia or H. pylori.
Yes,
I
we've got
also
quite a
bought
few.
We have from you.
Yeah, we've got quite a few. Yeah, that we've got from different sources. But most of the remedies we have here, we make ourselves from the starting material. That was when we started 35 years ago. That was what our goal was, to make a completely new source of remedies in the UK, starting from the original material. So, and this is what we still do as much as we can. We like to start, and then we do them by hand, still in the traditional way. And then we also have the cooking machines, which I can show you.
You have program prices.
Yes, we've got 3 actually, so I can show you them. Yeah. So just to give you a bit of a quick tour, because I mean we have 2 sides. We have this side, which is the pharmacy side and the dispensary, and then next door we have the offices and the manufacturing area. 'Cause we do.
Just I like to see.
We have a retail range of that are more industrially prepared, although it's on a very small scale. So we have 2 bits. This is the the open door, and we're making medicines up individually, 1-to-1, like you would in a clinic.
I saw. Yeah.
Yeah. But yeah, I can show you next door as well. So I'm going to come through. So just before we leave here, I mean, this is our shop.
This is the
And we don't sell much,
This is
do
the
we?
herbal. This is the herbal, not homeopathy.
Are these homeopathic?
Herbal, yes, that's
This
right.
is
We've got
herbal.
herbs, and we've got flower essences, and we've got a few
Cosmetics.
cosmetic-y things,
Cosmetics.
organic. They're really things that people who are interested in homeopathy like to have.
Yeah.
So mostly they come for
No,
remedies
we
and advice.
I am practicing only single remedies.
Yes.
Single remedies.
Yes, we too.
practitioner.
We
Yes,
too.
yes.
Is
I'm
it-
not using compound.
No,
Only
we
single remedies.
very good. You're a purist. Excellent.
Yeah.
Okay. So this is our main dispensing area.
Okay.
So all these boxes. These are all the remedies with A there and Z there,
Okay.
and then we have some common ones on the desks. I'll show you. I mean, we keep.
Oh yes, this is.
We
the
keep
old
them in this
traditional.
way.
Yes.
This is the old traditional way.
Old traditional.
Yes,
Traditional.
yes, that's right. So we still
In
use
the
the,
time of honeymoons and Kent and
we still use the tubes, and we
Yes.
still use the corks, and we still have some books to do the
Yes.
succussion on. I can show you briefly what we do. We have these dispensers already calibrated to
Yeah, Daddy.
to deliver 99
Okay.
drops,
99 drops.
and we use just the drop as the unit. So, for example, if we need to make a 5,
This is the back potency.
the back potency.
This is the
Yeah.
back
So
potency.
this is a 5, and that's 1 drop, and then some cork in there. So we used.
Yes, this is all our manual system
Yes.
of preparations.
And it's always in 90%
Yes.
ethanol.
9% and 1%
Yes.
is the medicine.
That's right. And then
You just give the
Yeah.
10 jugs.
we do 20.
This is the manual practice.
Yeah. So you get the shaking, the succussion, and so this is
This
how we
is I
do
do
it.
daily this
Yes.
type of practice.
So you understand.